Did you know that those individuals who are overweight or have obesity have a much greater risk of developing gout? Gout is a type of inflammatory arthritis that causes excruciating pain in the affected joint, like the big toe, the ankle, or even the knee. Uric acid is the culprit that is involved in gout. Obesity is associated with elevated levels of uric acid. Pair this with decreased water intake, a diet rich in meat and sweets, alcohol consumptions, and diuretic medications, and you have a recipe for a gout attack. During a gout attack, sharp uric acid crystals are deposited in the joint, leading to painful symptoms. When it comes to gout, where you put on pounds matter. People who have high visceral or belly fat, even if they're not overweight, are more likely to develop gout. That may be because belly fat produces more of the inflammatory chemicals that can trigger this disease. Just like for diabetes and heart disease, lifestyle changes can help to decrease episodes of gout. One of the best diets for patients with gout is a Mediterranean-style diet, one that is rich in vegetables and good fats and low in red meat, processed carbs, and sugars. Hydration is also very important to prevent gout attacks. Working outside in the yard on a hot summer day, maybe even having a beer while working outside without any hydration, is a recipe for a gout attack. And of course, exercise and weight loss play a powerful role as well. In fact, just a 15-pound weight loss can decrease a blood uric acid level significantly. If you're ready to lose weight and improve your health, please visit our website at healthymeweightloss.com to get started.